A very good evening to you, esteemed viewer. We are sorry for the glitch. We came in late, but here we are, of course, to take you through today's edition of the Family Hour. Edrine Osteen Mukalazi is my name. And today, being a Tuesday, we are here discussing family health. It is important to know about your health, and that is why we are here even this day. Of course, we send our condolences to the Catholic Church worldwide, and of course we pray for the smooth process of getting the new Pope. But here we are pushing on, of course, and today we are looking at oral hygiene. What is oral hygiene? Why is it important? Why, I mean, you know, when we talk about the mouth, it is really important that we pay much attention to our mouth. Have you ever imagined how it feels when you're talking to someone and they have to hide their nose away from you simply because what comes out of your mouth is really not good? That is why it's important that you pay attention to today's edition of the Family Hour. With us is Dr. Hilton Nahabwe. He's a dental surgeon, and of course it's a pleasure having you, Dr.
Thank you so much.
Good evening.
Good evening to you.
How have you been?
Not bad.
Okay.
Yeah.
That's good. Kindly greet our viewers before we get into our discussion today.
Okay. Good evening, ladies and gentlemen. Hilton Nahabwe is my name. I'm the president of Federation of Uganda Dental Student Association. That one takes all dental students in Uganda, all the universities in Uganda, including UCU, KIU, Equator, and Makerere. I'm the president of that federation. Okay. So when I'm here, I cannot forget to talk about that, as well as chairperson of Kawempe Health Workers Professional Circle, as well as the director of Divine Dental Clinics Uganda. All the Divine Dental Clinics, most of them, they are my brand.
Okay.
Yes.
That's interesting. Thank you so much for serving the nation. I was talking about oral health or oral hygiene. Yes. Someone really want to understand what oral hygiene is before we go on air. We had you had people were asking oral hygiene, what is oral hygiene? So probably there could be someone out there who might be asking themselves oral hygiene, and I mean,
basically oral hygiene is means general cleanliness of the oral cavity, something to do with the teeth, the tongue, and the oral mucosa within the mouth, just within when you open. But majorly, people take it for granted. They don't give it time. Actually, most people think about visiting a dental surgeon or a dentist when they have gotten pain, which is bad. When God created somebody, created a person, He gave you, whatever God gave you has importance. A normal human being has 32 teeth. But when somebody has lost some, like at least 2-4 teeth, that's when they start getting worried. Some get worried, but greater percentage don't mind. They're like, I still have very many teeth. But there's a reason why God gave you an incisor, a canine, a premolar, a molar. Every tooth has the function.
Okay. So,
yes.
What do you attribute this to? Is it that you people who would have raised the awareness, you're silent, you only wait for clients in your dental clinics, or?
Basically, not that. Because me, I've done sensitization. I normally go different radio stations. I educate. We normally do camps. We have done whatever we can, but putting an African to implement what we need, it is not easy. It is not easy.
Okay.
Yeah, so people normally come when they have pain, but at least we have done. The dental fraternity has tried, and we are still doing that. But basically, we do need at least everybody who is listening to us, at least twice a year, go and visit the dentist. They check your teeth. They need the service. Actually, the tooth is the hardest part in the whole body. These bones you are seeing, they are just flexible, and this enamel is the hardest part on the person. But once it gets to get destroyed, very simple. It is destroyed. So basically people don't know actually the importance of the teeth. Before we go far, how do oral hygiene? How do you do it?
Exactly.
People
You
don't
told
know
us.
that,
You
yes.
told us that every tooth has an importance.
Yes.
So we start from there. So that probably we might know that if I'm losing my canine,
Yes.
then these are the functions it has been playing, and that is what I will have lost.
You have brought a good. You have at least. I will begin, I think, from canine. But generally, the general function of the tooth, number one, is for beauty.
Okay.
So beauty, when somebody is smiling, we'll not smile then I put that head. We'll put that what? We'll put that the teeth, like that smile of sister. So smile, beauty, at least we gauge from the what? From the smile. So once the teeth these front teeth have disappeared, you have lost them, beauty number one is gone. But
you'll start shying away when you're smiling. You cover your mouth.
Exactly. So, if somebody does not have a teeth, beauty goes away. But now I want us to begin from the molars. Molars are for grinding and chewing food.
Maybe to help someone understand.
Yes.
Where is the position of the molars in the mouth?
Molars are these last teeth.
These ones this side?
Yes.
Okay.
And they come at the age of 17 to 25. Some people, like 5%, okay, that one, academicians may ask themselves, may say why, like where that one have not, but around there, it's not approved academically. Around some few percentage that don't have them, those last ones. The last molar, but you have, every normal human being is supposed to be having 12 molars, three. But sometimes you find some people don't have those hard ones, but other people have. Like today, there is a person who came with the pain, but I found he's having an excess tooth. We call them supernumeraries, an excess on that end.
An excess molar.
And from the molar, there is another tooth there.
There is that tooth they say that comes when you're aging, maybe about 30 or 25.
It is 25, and that is very painful. That is a sad wisdom tooth. That
it's called wisdom tooth.
Yes.
Is that the one she had?
It was beyond that. It was an extra. A nyongeza. It was an extra tooth. So molars are for grinding and chewing food. From there, when we go to premolars are like molars, but a bit smaller.
Are they the ones closer to the molars?
Yes.
Okay.
Those ones we have two premolars, up and down. But those ones almost
two up and two down.
Yes.
Okay.
So those ones almost they do the functions like for premolars, for molars. Now canines are these ones. They make the corners of the mouth.
These ones that look sharp.
Exactly.
Yeah.
But most people, I want to insist on canines. Most people they normally bring their children because those canines sometimes you find they are like outside, out of position. So somebody like, I have brought my child, I need what? I need them to be removed. A professional dentist will not remove those ones. If somebody is like, let's remove your daughter's or your son's canines at the age of 10, 9, 11, that one is not a dentist. Run out for your life, for your child. So, because those ones, they are the ones making these corners. God created you like the way they created, like they built this building. Paul made you and gave you corners. If you remove all those corners, now this thing, the mouse will fall in. So, what does it imply? You are not supposed to remove them. In case somebody reaches the age of 12, when the teeth are not normal, go to the dentist, and in dentist actually after doing dental surgery there is what we call specializing. We have maxillofacial surgeon, we have orthodontist, we have a pediatric dentist. So we have different specialties. So you go to an orthodontist and they put what they call braces. I think you have seen that.
Yes.
These days they are common.
Yeah.
They are common because people are informed. If people are not informed, they wouldn't be going for that. So people put on braces to put the canine in its place. Braces, they have other importances. You find somebody has, like the teeth are not biting well. Somebody find he has open bite and cannot bite like me. Like the teeth stop somewhere. Those challenges, they are solved by what? By braces, by an orthodontist. A male dental surgeon may not do that. So those are hypotheses of canines.
Okay.
Now, incisors,
These ones, yeah.
for biting. But basically, these incisors, they are the ones and canine which make you to smile. If you smile, they are the ones they see.
Indeed.
If you smile, they see incisors and the canines. These are the premolars. That's why people, they normally remove, because they are still removing molars. They don't mind. They don't mind. So there is a reason. Okay, most people, out of like 100 people, people who normally come to dental clinics, at least 70%, the teeth which are normally removed by dentists, at least 70% are the molars. Why? There is what we call pits and fissures. Pits, those molars, they have holes there.
Yes.
So even if you are blasting, you cannot blast effectively like the way you are blasting these incisors. So that's why they are affected so much. So even when you are blasting, I was caught up by time I didn't bring my model. Next time when in case I get an opportunity, I will come with a model. I teach the public how do they blast. How do you do
the molars?
Or the teeth.
Okay.
Because we do blast, but we don't blast professionally. Yes.
I thought it's a matter of getting toothpaste on a toothbrush and then
brush and go away. No, that's not the thing. The ideal, as you have said, it is a toothpaste. Toothpaste means to smear something, like the way you paste your shoes. So how if you paste then and worse, you have not pasted, you have used that as soap. It is not a tooth soap. So basically, people who are listening to us outside there, the basic way, what you are supposed to be doing, first get like in science we used to call them list of apparatus. First get your toothbrush, get your toothpaste, get your water, get ready. Start the process.
Let's take a short commercial break. When we return, we are going now to look at. I have all my apparatus, as we call them. I have and all that, and then getting ready for the brushing exercise and how long it should take. Stick with us as we come back shortly. Welcome back from the commercial break. We are looking at the importance of oral hygiene. Why is it really important? Like I said earlier, have you ever imagined if you're talking to someone and you realize they don't want to draw their nose closer to you, or probably you want to laugh while others are laughing, but you can't laugh freely, so you have to keep on covering your mouth, talk while covering your mouth, because probably you have something that is wrong with your mouth. Now, we are looking at the importance of this, but also how you can maintain this hygiene, because it is really very, very important. And it is cross-cutting. It's cross-cutting between all of, for the children, for the aged. All of us need a proper dental hygiene. That is why we are here this evening today. Doctor, before the break, you are telling us that prepare yourself. Get what you're required of. We have people who do not want to use toothbrushes. Maybe they use a stick. Yes. They use others don't want to use toothpaste. They use other concoctions like ash. Some have been told to use charcoal, things like that. So what is, what and which kind of toothpaste should people use? Because we are told that toothpaste, different pastes have different, maybe minerals. Some that are good and some that are not good for our teeth.
Okay. We are going to move from how do we brush. Already we have already set our apparatus.
What we talk about now the selection of a toothpaste. For example, in a shop, a supermarket. Which kind of toothpaste should I buy?
When you reach in a supermarket, I don't want to be one-sided. People maybe people have hired me or what.
We are not talking about brands. We are not talking about minerals.
Yes. Whenever you reach in there on the table, first read on, is it having fluoride?
Okay.
So what the nutrient we need in that toothpaste is majorly fluoride.
Why fluoride?
Fluoride helps in the process called remineralization of the teeth. Even if your tooth had started having some little hole and you start using the method I'm going to tell you right now tonight, your teeth will recover. For me, 16 years back, I was checked, and the dentist who checked me was like, "Oh, you are bad off." They checked actually like 8 teeth. They were having like holes that had just began. But after changing, now I no longer have them. My teeth are okay. For the last 16 years, they recovered because I changed the tactic, the method I've been using. I'm now blasting professionally. So how do you do it? You are supposed to first do what we call tooth cleaning. Get your already set apparatus, our toothbrush is there, water is there, toothpaste is there. Get your brush, pass some little water in the mouth, first clean. Clean very well. I told you when
with
I come.
With a toothbrush that doesn't have...
Which doesn't have a toothpaste.
Paste.
Yes. Clean up and down, clean inside, clean on the fissures very well. Rinse with water. Even clean the tongue, rinse with water. Ideally, you're supposed to do it even after meals. Because when you have just eaten, the food has not yet stuck. So no need of using a lot of energy, taking a lot of time, no. So when you have done that, you have cleaned the tongue very well, cleaned the teeth, you pass there the tongue and feel, are they soft, are the teeth soft, is the food done? If you feel like you are still not okay, canvas and brush again, do it. Then after I've done that, now get your toothpaste. Put there the sizable amount, like a peanut, 2 peanut sizes, put on the toothbrush, do it again. After doing that, just spit that foam that has formed there. Don't rinse again like with water.
Hey.
Until you have pasted.
So that's why we call it toothpaste.
Yes. You are pasting your teeth, not washing them. It is a soap that you used to wash, but you are pasting the teeth.
So what about this that we call brushing? I think that is where we get it wrong from.
Yeah.
Because for us, I'm brushing my teeth.
Yes.
And then you don't paste
yeah, exactly.
after brushing.
We blast, but when you have already combined the two space, you have spoiled teeth. First do the first method, first blast, clean the teeth very well. After you paste them.
So why is it important for you to paste your teeth? And for how long should I keep this paste in my mouth?
Provided you have finished your blasting very well, you've pasted, spit and leave it there. It will go by itself. That chemical, that paste that has remained there, there is a way it will do the other process of remineralization. It will do that process of remineralization little by little. You may not see it personally. You cannot recognize it, but it will take place. It's independently within itself. That fluoride will help you. But if you keep rinsing as the way you've been doing it, you will not have helped yourself.
So how long do I take with this paste to eat something?
After you have brushed, no, there is no guarantee that you should not eat. After at least give it like.
Am I not going to eat the paste and swallow it?
Oh no, I've remembered. No, actually, people have been doing the mistake. You wake up early morning, you are coming to present at 5 a.m. No, let me talk like 7. Yeah. 7, you are supposed to be in class, you are a teacher. So you will wake up at 6, you go and bathe. After bathing, you brush, then you go to school, you brush again in the evening or tomorrow morning. That is a big mistake. Yes.
Why?
Did you sleep eating? At night you didn't do what? You have not slept eating. Why are you brushing at the morning? Rinse there with just...
There is an order that is coming out
I know. So we just... Because you will not blast at the morning at 5, then by 8 you blast. You'll be like, I have blast in the morning at 5. Yeah. So you take it for granted. If it can be possible, like people, let's say full-time staffs of Family TV, if you can, try by all means, make sure, even people listening to me, go move with your tissue blast in your little bag. When you have finished your breakfast, do that process very well. Take some good hours minus eating again. If you want to eat whatever you want to eat, package it very well. In the morning, I must eat my fene. I like my soda. Put everything on the table. Eat. After you've packaged enough, brass, no, you are going to take 6 hours minus doing what?
So after all this, now we know we are supposed to brush and how often we are supposed to brush.
Yes.
What are some of the consequences that await people who do not follow the proper oral hygiene? Before we talk about this, you also talked about brushing the tongue. Why is it important that while you brush the tongue as well?
On the tongue, there are something like holes. Actually, if you want to test it very well, you get a Coca-Cola soda. Then you take Mirinda fruit. You take, after taking, you pull out the tongue like this. You see the tongue is red in color. Why? Because of those holes. So, it absorbs this food and soup, whatever you have taken, they remain there. And the bacteria will decompose them. Then eventually halitosis, smelling the mouth. So if you've been brushing frequently, there is what we call mouthwash. Mouthwash, today I will not talk about it so much. I will talk when I come back next time. But if you use the mouthwash, you brush very well, but still halitosis is still a challenge, and they have cleaned your teeth. You went to the dentist and even they did the scaling and probably they cleaned the teeth very well, but still halitosis is not going away. There it needs now to check with the physician. Maybe you're having a GIT disorder, you're having a problem from the stomach. So brushing the tongue is because the tongue has those holes, it retains the foods and those liquids, sodas, whatever you have taken, the soups, and they decompose to form that bad odor, halitosis. That's what you are saying. Sometimes somebody speaks near you and you are like, what's this? So it becomes very bad, So whatever you are doing, don't forget brushing the tongue.
Okay. Now, consequences of poor oral hygiene.
In English, they used to tell us when we were in primary that prevention
is better than cure.
But now in dentistry, it's not only better, but even cheaper than cure.
Prevention is cheaper than cure.
Yes. So why, how? If you have lost a tooth, and I normally get calls, as I've told you, I have 2 branches, different dental clinic, Kanonugomba, and here in Kampala, also I have another branch. Somebody calls you, I need a tooth, I lost my tooth, but I need the one which cannot be removed. We have types. There's what we call a bridge, there's what we call an implant. But let me start with an implant.
There is what we commonly call cement. So where does that fall?
Oh yes, that one is okay.
Because someone would really want to understand where does that fall, in which category.
Yes. So we have second, as I've said, the prevention is better than cure. When we are blushing, that is primary prevention. If you don't do that primary prevention very well, now we are going to take you in secondary prevention, which is cementing. When the tooth has had a hole, and it is when it disturbs you, when you eat something, whatever you take, it disturbs you, you feel uncomfortable, there you have to visit the dentist very fast, and they put there a cement. So that's why cement comes in. But some people at that moment, they normally dodge eating from that side and they change the side.
Yes.
You are not helping yourself. It will worsen. When it worsens and it starts paining you day and night, and you start taking painkiller, the day the painkiller will stop, you will come to the dentist. You will go visit the dentist when you have an abscess, when the cheek is swollen. Actually, I've myself personally visited the vigil, the burial ceremony. People died from dental problems. Yes, people die from dental. Don't say no, dental does not kill. People die, but they are not. It's not documented. They die from there in the villages. Yes, if they worsen, others die from Lago, but documents is the documentary is the problem. Yes. Why? Because of not going for dental, of not following these preventative methods. So, if you miss going if you don't brush very well, we now go secondary prevention. If you don't go for filling and the tooth pains you, still we do. I think this one falls in tertiary. There's what you call root canal treatment. Root canal, that's involves the removing the nerves, and we make the tooth painless and remain with the tooth.
So the tooth remains, but without
it will never pain you again. But that one goes along hand in hand with crowning. You have even to put that crown. The filling which would have gone for 100,000 in Kampala, now if you wait for root canal and crowning, you now go like for 800, 700,000 in a good clinic. So what does it imply? It's always very important. People who are watching us down there, go for a checkup twice a year. Go and they check your teeth. Some people outside there, they're having insurance. Somebody has insurance card. Going and they check you. When they find the small hole, they feel it. You wait because you have insurance card, you will come for root canal. Those things, they take your time. How much you're having an insurance card, but you don't have time. Instead of going and visiting, checking on your cows in Ruel, do you have time to keep moving a dentist every day? No. Prevent your teeth very well. Visit your dentist often. You go there, tell doctor, I'm coming on Thursday, make appointments. Coming on Thursday, I have there 30 minutes. They book you, they know at 8:30 to 8:45 or 50, we are going to check Edrine. Only 20 minutes, they check you, go and do other things. Because visiting a dentist often they also, it's not nice. So, consequences, very expensive to replace the teeth, very expensive. So in the long run, of course, beauty will go away, self-esteem will go away. So if you want to bring them back, of course, some people lost all the teeth and they need implants from this side to this end. And if you can manage, and maybe you are working in Bank of Uganda, you may manage, because each implant, at least in Uganda, each tooth like this, you want an implant, that is 80 million. You get 80 million times 30 teeth. How many million are those ones? Thinking 240 million.
That's a lot of money.
Put the whole mouse. Yeah. So somebody listening, watching us down there, consequences of not looking at after our teeth as many as we can. Even this is a major, and I told you I have buried more than 2 people. Others are just here. Hey, somebody so and so died from this village. But the ones I went physically to hear what they are saying. Somebody comes to the clinic, is having pus is coming from here, and it's like, I've come for you to remove my tooth. Then you are like, this is beyond. But why? Because they're in the village, they don't want to go for treatment. Yeah.
Then what about ways? Because you realize that tooth decay is really very, very common. So what ways? Or what can people
How
do
we prevent?
to prevent these decays?
Number one, of course, I've been repeating this, but I have to repeat. That is what we're supposed to do. Number one, blast every after meals.
Okay.
Secondly, avoid eating sugary foods or sugary snacks between meals. You've taken, as I said, if you like those snacks, you like chocolate, you like candies, you like your sodas, pack everything. Eat them with your breakfast. To eat again at lunch, pack them. Supper, if we don't restrict you from enjoying your money.
You eat them at once.
Eat them once, plus. But now you have eaten, after eating this little breakfast, by after 1 hour, sombosa you bring, you take. At 10.
Mochomo.
At 10. Pancakes you bring. At 11. Give me some soda. You are spoiling your teeth yourself. You cannot you cannot dodge suffering from what? Dental problems. So avoiding eating too much food, then too much sweet, that is the second point. Thirdly, you should at least eat fibrous foods. Fibrous foods are foods like apples, sugar canes, pineapples. Those ones, they help. When you eat them, the way they clean your teeth. And of course, most of those fruits, they contain vitamin C, which helps in even strengthening our oral cavity, like gums and so forth. So they are also important. Another fourth point, visit the dentist at least twice a year. If you say at least, you can even visit 4 times. The people come to my clinic and they normally ask, what should I do? Like the way you have asked me. So, and you find his oral hygiene was not good, telling this person to come after 6 months, you find the problem has worsened. You tell that person at least every 3 months, which means every term, when the term ends, if you are a teacher, come back in every other day you come. Come and we check and we see where, at least after doing a visit for 2 years, you may say it has improved. Now let's prolong to 6 months. So it is very, very important to visit a dentist twice a year, every 6 months. At least if worst has come to the worst, twice 6 months, go and check your teeth. You'll be free to go.
Okay. We've talked about brushing, but
Yes.
we've not talked about how often someone should change a toothbrush.
Oh yes, I forgot that. Every 3 months we are supposed to change.
Why?
By the time it finishes 3 months, even if you look at these bristles, if they are at least 3 months, they have already turned. So when you just wait until it gets rusty, that is a problem. You will no longer be brushing your teeth. You will be brushing, but you will not get what? They will not get clean very well. So every 3 months, change. That toothbrush it costs like in the supermarket 2,500. So which means in a year you can change 4 times. That is 10,000. 10,000 is better than now using one for 2,500. Then you find every year you are moving a tooth. That one becomes expensive in the long run. So you people outside there, listen, try to implement this. Implement this, you will not regret.
There's also been an issue of, for example, a talk of soft toothbrush and a hard toothbrush. So which is which? Which one should someone use? Which one is more appropriate to their teeth, our teeth?
For children, we recommend actually those ones for children, they are there. But for an adult like you, why go for? Okay, we have even the one which is, it is what we call smokers toothbrush. That one actually is used by dentists, like to help you and remove some stains. That one, even if you use it, it will scratch your gums for nothing. That one you don't need it, but the dentist may need it to help him in a procedure. So the medium, I think the medium one is the best. But these ones which are soft for children, because for them their gums are still soft, they are still growing. It does not need to be traumatized like for me. Yes, but after 3 months, change your what? Toothbrush. Very important, yes.
As we wind up, kindly give us your closing remarks, especially emphasizing the importance of oral hygiene.
Okay, as I wind up, I want to encourage my friends outside there. Basically, try as much as you can to visit a dentist twice a year. Secondly, brush your teeth. Okay, love your toothbrush. Make sure there is like, you can get a small package where you can pack it very well, and your toothpaste, whenever you are going, because most of us, we are in digital world, we leave home at 6, we come back like at 8 in the night. So all those hours, you have brushed in the morning, then you want to come back at night and you brush when you have eaten like 5 times. It does not make sense. Move with them, put them in your bag. So that when you're at work, when you finish your lunch, go and brush. You'll not get a burden of in future. You will not regret. So I think then avoid eating sugary snacks as much as you can. Yeah, I think that's all.
Thank you so much, Dr. And thank you so much to your viewer. It's been a pleasure having you watching Church of Uganda Family TV. Edrine Osteen Mukalazi is my name. Today, we come to the end of our edition of Health. Tomorrow is a Wednesday, so we shall be back with our edition of Finances and Wealth. I've worked with Jonan, Didmas, and from the entire team, we wish you a blessed night.